You shed 30 to 40,000 skin cells every minute, but dead skin still builds up without regular exfoliation. We can help. We're Diamond Tome, the exfoliation experts. Our professional diamond tip face and body wands treat the entire body, head to toe. From rejuvenating facials to luxurious body treatments, give your clients smooth, touchable skin year-round. And since no exfoliating treatment is complete without sun protection, we're giving away a DT Protect SPF 30 to the first 10 people who call us at 866-325-8247. Experience the Diamond Tome difference and learn more at diamondtome.com. Do you see yourself as the rebel who challenges the status quo on skin health? Learn how to be a critical thinker, discover innovative solutions to skin conditions, and facilitate individualized healing on a deeper level with Truth Treatment Systems. Truth Treatment Systems provides you the products and tools to unveil the truth behind skin conditions. Sign up for a wholesale account today at truthtreatmentspro.com and receive 10% off your first order. That's truthtreatmentspro.com.
Hello and welcome to ASCP Esty Talk. I'm Ella Cressman, licensed esthetician, certified organic skincare formulator, and content contributor for Associated Skincare Professionals.
I am Maggie Staszcuk, licensed esthetician and ASCP's education program manager.
And we have another shout out. Hey, Deanna Travis of Shelbyville, Tennessee. Thanks for listening. We're glad that you like it. Today is going to be a really fun topic. I'm excited to chat with you about it, Maggie, because I think we've talked before about a lot of things, and one of them is the influence of medical aesthetics in our profession. But we also have medical aesthetic opportunities as an influence for our culture.
Yeah.
Big time. And I think in my lifetime, that has changed. And it seems like in the last 15 years, the opportunity for that influence has exponentially grown.
Yeah, I think it kind of ebbs and flows, right?
For sure. I think when we have that overlap too with aesthetics and medical aesthetics, there's some interesting things that happen. The other thing that happens is trends come and go. And it seems like some people attach to trends normally and it makes sense. And then other people attach to trends and then turn up the volume.
Oh, yeah, totally.
So I have always had big lips, beautiful big lips. It's a thing. Like people would tease me about it in elementary school, but little did I know that, there's a lot of things about me now that are very on trend.
Embrace it, girl.
One of them is my lips. But at 44, 43, 44, I started to notice the volume loss. Normal aging, they're still pretty for my age, but I did have, talked to my injector. I'm like, can I get a little bit? Do you think it's time? Because we've had that conversation for a long time. Tell me when it's time. So I'm like, do you think it's time? She's like, yeah, I think you can do a little bit, keyword.
Yeah.
I got them done. They swell up after you get them done, just a little bit. So much. I'm like, what did I do? This is crazy. But then once the swelling went down, I'm like, I should have done more, which is what she told me. You're going to want to do more. But I was like, stop there. So I can see the desire for more once you're in it. Now, I haven't had it done for a while, but I had it done. I thought I was being undetectable, but my sister-in-law asked me, and I'm like, dang it.
Yeah. I mean, people that look at you every day, I think they notice those little tweaks or enhancements that we do. And I wouldn't put filler in the category of plastic surgery. But to your point, you hear about these people that become addicted and then they can't stop and they look weird.
Yeah. And that's, I think, easy when you're doing those little tweaks, like you said. The little tweaks add up to big tweaks. And I think that a lot of people found that to be the case with their dermal filler. And then now you hear a lot about dissolving of the dermal filler. So first, let's talk about what is a dermal filler.
Yeah, so dermal fillers, they're like a gel or jelly that get injected under the skin, and it's meant to just smooth out the appearance of the skin or give it more of a full appearance.
And there's a lot of different types of fillers, mostly hyaluronic acid. By the FDA, there's only one that is not temporary. It's a silicone of some sort, and I don't remember what it is. But there's only one type that's permanent. The rest are temporary because they're made of hyaluronic acid, your body slowly absorbs them, but sometimes not quick enough. So the way that they're dissolved is by injecting the enzyme hyaluronidase, and that catalyzes the hyaluronic acid, so it speeds up the degradation or the absorption of it. So in effect, neutralizing it. But people have, like celebrities all over, have been getting this done. Courtney Cox, we saw. But did you think she was getting odd looking?
I guess I haven't been looking at her, but in any photo that I've seen, I've never looked at Courtney Cox and thought, oh, she's weird looking.
What about Melanie Griffith?
Yes.
Okay, so she's the one that got hers. Simon Cowell had his removed. Danica Patrick, Khloe Kardashian, and Kylie Jenner. And then Black China is one who is like most recently everybody's talking about hers. So she got her facial fillers, and then she had other fillers put throughout her body because that's something else that could be done. What I thought was interesting about hers, I never realized she had facial fillers, but her face was always very angular, and I cannot wait to see what she looks like normally. So some of those things like the angular look, that big cheeky look. Another one that had hers done was a celebrity in my world is on The Real Housewives of Miami. And hers was the same thing. It started to get where they all look the same. These really high cheekbones makes the eyes look squintier, like almost alien.
Yeah, I feel like it's like this cat face almost. But what's weird is that there's this trend now to take out buccal fat, which I feel like is also giving almost that same appearance where you have really high, prominent cheekbones, but no cheek.
But what's the long-term, I wonder what the long-term effect of removing that buccal fat is, because that's one of the things, well, it migrates with gravity, but also, and that's one indication of like age advancements is the movement of that.
Oh yeah, you get those sagging jowls.
What's the long-term effect of not having that? And I think that is another important thing. Recently, I saw an interview with Black China where she was talking about her plastic surgery journey and why she's going through all of this. So she had her dermal fillers in her face dissolved, but she had also had her body modification, let's call it. So she had, in 2007, at the time was before Brazilian butt lifts was a thing, but she had injections into her rear end. And she said that at that time, she was 19 years old in her environment, the people around her where she was working, that was her ideal of beauty was this large backside. And so in order to get it at 19, that she had these injectables. But the thing is that at 19, she wasn't fully developed yet. And so she's dealing with these modifications that have potential long-term consequences. I thought that was so important because we see people now, I'm an adult, I want to have an augmentation of my breasts, or I want my lips done, or I want this dermal filler. These young girls wanting dermal filler in their face to have this trendy look without the foreshadowing or the looking at the consequences, the long-term consequences. I thought that was a very interesting point that she made.
Yeah, totally. And I got two things to say about that. First, I remember, I don't know, maybe this was like 5-ish years ago, where like the duck lips was trending and young girls were specifically getting injections in their lips to have that pout, which I thought looked ridiculous, by the way. And it was also when selfies really became a thing. And then also, I know a lot of injectors and young girls who were coming together and doing like Botox and things of that nature on people who are like 19, like Black China at the time, and saying that this was preventative care for aging.
That's just crazy to me. I mean, a little bit. Like let me tell you guys the story of the first time I ever had Botox. I went to my still injector, still go to her. I was in my early 30s, okay? Not 19. I was in my early 30s. And I had these 2 little baby lines close to my hairline. And they were baby lines, and I knew they were there, and I wanted them to stay baby lines. So I said to my injector, should I get a little bit up here? She's like, oh God, I guess. Like, I don't know why you're doing it. You're so young. It's not even showing up. You have nothing. She went through this whole spiel, pretty much literally rolling her eyes. You know my injector, so you know exactly her personality. And then she's like, fine, and I'm going to do your chin. And I was like, what's wrong with my chin? So they have a different eye, but I think a responsible injector would take those into consideration, which is another point. We're going to quickly move on to this next subject, but I did want to point out the other thing that people, speaking of body modifications, and when you're younger, some people are also removing their breast implants either completely or sizing down. So that's an important consideration. When you're young and want that, think about it. Even though they say they're like 10-year lifespan. Have you ever heard that?
Oh, yeah, for the breast implants?
Yeah. Somebody said that to me. I'm going to get them. I'm going to get them. Oh, they're good for 10 years. They said, my mom's had them for 40.
Comes with a 10-year warranty.
Yeah, it's crazy. But the other thing is this Michelle K., she had surgeries, a bunch of surgeries, and blood transfusions in 2018 because she had illegal butt injections. And she had, I don't know exactly where she went, but she had them done. You know the story too, right?
Mm-hmm. Yeah.
So she had them done, and where they were inhibiting some blood flow. There was too much volume. It wasn't sustaining. There was a lot of problems, but it was affecting her health. So I think I would want to encourage people before they're, like, if they're younger, or if they're going to another country, as we kind of talked about before, like, think about where you're going and if they're reputable, because that's potentially dangerous.
Yeah, for sure. I mean, really scary. And I think all of this, whether it's the butt injections, breast implants, also even with the facial filler, this is in line, I think, with a lot of the topics we've had in this year and even the end of last year. We're seeing this clean and green and everybody going back to all natural and accepting aging, this pro-aging, as opposed to trying to stop it, if you will.
And I think that I'm hoping that pendulum swings for body positive. I mean, we see a big, big movement on body positivity. But if we look at the trendy body from our youth, mine and yours, because we're about the same age, if we look at the 80s ideal body.
Oh, yeah, I was going to say Baywatch.
Yeah, no back, all front, thin eyebrows, like that.
Yeah.
Tan,
yeah,
gauntly sometimes, right? And then we look at the ideal body, like the trendy body right now, the body that is, feminine with hourglass shapely, even though there's extremes. Like there was extremely skinny and straight, and now there's extremely curvy, whether they're enhanced, modified or not. But I guess what I hope is there's some healthy pendulum swing, because you can have those things naturally. You can be disposed for a certain body type and then do squats or certain things to change. I can, work out my midsection and increase my hourglass, So there's opportunities for natural body modification. And I think it's okay to have some surgical, some aesthetic assistance, but just make sure that you're doing it responsibly, I guess.
Hold that thought. We'll be right back.
DMK is the world leader in paramedical skin revision education, with certification programs designed to give licensed professionals a thorough understanding of the skin and an in-depth study of the DMK concept of remove, rebuild, protect, maintain. Created by the botanical visionary Danae Montague King, DMK offers skin revision training and education for all ages, skin conditions, and ethnicities in more than 35 countries, harnessing the body's innate healing mechanisms to change the health of the skin. Learn more at DanaeMking.com. That's DANNEMKING.com. Elibana, Australian-born, globally loved. Elibana's story is simple. They love lashes and brows. They shoot for the stars and lift lashes to new heights. Their addiction is real, their passion is popping, and there is nothing more they crave than offering excellence, service, and innovation in products. Elibana Lash Lift allows you to offer your customers luscious, lifted lashes that can last up to 12 weeks in one safe, 20-minute treatment. Learn more at elibana-usa.com.
Okay, here we go. Let's get back to the podcast.
Now let's talk about another really cool, I think, an exciting development in the industry, and this is an alternative to Accutane. This is the AviClear from Cutera Lasers. But first, let's talk about what is Accutane.
Accutane's been around for a long time. And it is, Accutane is the trade name, but it's known as isotretinoin. It's a powerful drug. Really, it should be reserved for those grades 3 to 4 cystic acne. I think, unfortunately, you do see people that are prescribing it for 1s, even 2 grades acne. And it is for patients who have failed to respond to other treatments, failed to respond to the benzoyl peroxides, the antibiotics. That's going to be things like your tetracycline, your clindamycins, things of that nature. And it has many, many side effects. And so I just want to say this is according to American Osteopathic College of Dermatology. So many side effects, but in some ways it is safer than long-term antibiotic usage. And most other acne-controlling medicines are antibacterial agents, which are effective only if used daily. I think that's interesting. There are over 2 million people that have taken this drug, probably more, and there are a lot is known about its safety and effectiveness. That, I think, is an interesting statement because Accutane is known to have a ton of side effects that are not safe. Really, what it's doing is reducing sebum production, and it also dries up all really the mucous membranes in your body. That's in your nose, in your mouth, in your digestive tract. And I think it is the devil.
I think it's a very dangerous option too. And it scares me when that seems to be an option for some of my clients or patients because when that's a last resort. But there was a time that I was working for someone else down in Cherry Creek here in Denver for the people that don't know. So that type of person that is in Cherry Creek is very demanding. And this is generalizing because there's a lot of nice people there too. So before I get any emails. It's a lovely place, that Cherry Creek. But this person in particular, I mean, she probably had milia, right?
Yeah.
We live in Colorado. It was probably dry. And she was dead set she was going to get on Accutane. I said, I don't think that's the right thing for you. And of course, she came in about a month later, even more broken out than before because her problem wasn't oil production. It was underproduction.
Mm-hmm.
So here she's taking this drug to reduce production and she's having an adverse effect. Could have told you that. Oh, I think I did tell you that. But anyways, then my longtime assistant, she had been on Accutane before she came to work for me, but she has joint problems. She has digestive issues, all these problems. And her mom was on it too. Very similar things, long-term problems. Her mom was on it 30 years ago and is still suffering through side effects. So it's not, I think it can work really well for some people, but it's not a quick fix.
Right.
But the way it works is to reduce the sebaceous gland or kill it, in essence. So the difference between Accutane and this AviClear is that this is the first FDA-cleared energy device for the treatment of mild to severe acne, which is awesome. And what it does is it freezes the sebaceous glands. What's different here is that you're doing it in a direct way. So not a systemic way where you're not worrying about your knees or your reproductive tract. Like you don't have to take a pregnancy test as you would with Accutane. And the after effects, because I won't treat anybody for a year.
Oh, yeah.
Some people say 6 months, but about a year after they've been on it, just because their skin is so fragile. So fragile. So I think this is really exciting. Some of the pros are that it's targeted towards those specific areas. It's FDA cleared. And some of the cons, though, is that it's young technology. So there's no long-term studies. The cost, they say it's about a treatment series of 3. And the series itself is around $3,000, depending on where you are. So it's mighty spendy. But I think some people may pay that. What do you think?
Totally. When you have a client who is suffering with that cystic acne, it's scarring both physically and also mentally. And to have a treatment like this that's going to clear them up and have long-term benefits, absolutely, you're going to have those people that are willing to pay.
I think it sounds so exciting. I'm very encouraged with this as an option. Like you said, there's physical scars, but also the emotional scars too. And I think this is a really cool advancement. And I hope that the long-term studies are enforced with this result. So I'm very excited about that. Another really exciting thing, I know you've seen the commercial for this new prescription for vitiligo. So before we talk about that, let's talk about what is vitiligo.
Yeah, what is vitiligo? So this is a condition involves loss of pigment. It's hypopigmentation in patches, and it is considered an autoimmune disease. Generally, this depigmentation, this is occurring the face, the neck, the scalp, areas where there might be friction. So it could be hands, creases on the arms, or in the groin area. And again, considered to be an autoimmune disorder. So people who have vitiligo may also have at least one other autoimmune disorder.
I was surprised to learn this. I was surprised to learn that there's flare-ups, that there's vitiligo flare-ups in my ignorance. And we studied this. Maybe we skipped it or touched on it. Just another illustration of all of the things we learn after we get out of school. But I thought you were born this way, like in my mind, certain patches of your body had albinism.
Mm-hmm.
That's what made sense to me. I didn't understand that this could be a flare-up from stress and you'd start to lose pigment in other places. It's almost like the melanocytes just die.
Yeah.
And so there had been previous treatments was to implant melanocytes into the basal layer.
Which I think is so fascinating.
Yeah. How did they do that? And how much was it? And wow, do they grow from there? If they're implanting them, is it painful? I have a lot of questions. But now there's a certain type of vitiligo called non-segmental, which is the most common form. And in July 2022, the FDA approved this medicine for the treatment of addressing repigmentation in patients 12 and older. So they had gone through all of the testing, all of the clinical trials. They did 2 clinical trials, and they found that there was positive advancements or positive results from this. The medicine is called Opzelura, and it was showing they're applying this cream twice daily for 24 weeks, and then 28 weeks of the actual medicine. And at the end, 30% of the patients had at least a 75 improvement of the facial area, and compared with 10% of placebo patients. So this is really exciting. The most common adverse reaction that they found were site acne, itching, or a common cold, headache, urinary tract infection, application site redness, and fever. And I'm wondering if it's because this would be immunosuppressant, potentially.
The cream itself?
Mm-hmm.
That's interesting because if we're saying vitiligo already is an autoimmune disorder, applying cream, yeah, maybe, I don't know. It's something to study more.
Yeah, very exciting. But I think what this could bring as far as relief for people who suffer from this, because I can't imagine. I know that I have hyperpigmentation. I know that I know how to soften that, whether it's with makeup or with creams or, treatments. I can't imagine that it's not being there, It's one thing to know how to turn it off.
Right.
But if it's dried up, oh my gosh.
Yeah.
So I can imagine very similar to acne that there would be emotional scars with something like this.
Yeah, absolutely. It's very interesting. I think the science is very interesting. I've seen the commercials. What I think is interesting with the commercial is that they do show a after photo, but there is text on the screen that says this is an illustration.
Ooh.
Yeah.
Ooh, Hawkeye.
Right. Yeah. And so I'm really curious. I mean, when you think about just pigment in general, there's different types of pigment and what the melanocyte is able to produce. And I'm very curious to know if, this drug is so effective clearly by their studies. Are you producing pigment evenly? And is it the same tone, if you will, as all of the other melanocytes that are actively producing in your body?
Are the melanosomes the same size?
Yeah.
That's a very interesting question. From what I can gather, it's peppered is the best way I can describe it. It would be like
Sure.
peppered pigment.
Right.
Because that's how they're coming back to life.
Yeah.
But yeah, I guess let's see. Let's watch and see, and maybe we'll have an update. But lots of exciting advancements here. So listeners, we really want to hear from you. What are your thoughts on these latest medical aesthetic trends, devices, medications? Be sure to let us know. Comment on our social media posts or send us an email at getconnected@ascpskincare.com. We want to know all the details. In the meantime, thank you for listening to ASCP Esty Talk. For more information on this episode, or for ways to connect with Maggie or myself, or to learn more about ASCP, check out the show notes and stay tuned for the next episode of ASCP Esty Talk.